Great to have you here. Like most health centers in rural communities in Ghana, the Amoma Health Center, which serves over 9 communities in the Kintampo South District of the Bono-Ahafo region, is in dire need of infrastructure development. Men, women and children have to share the only inpatient ward. In the absence of the only midwife in charge of the facility, pregnant women would have to return home or risk traveling several hours to the next facility. The poor nature of roads linking the community to its district capital is also preventing patients from seeking health care when referred. JoyNews' Anasabit visited the health center and came up with the following report.
Communities under the Kintampo South District of the Bono-Ahafo region is in dire need of accommodating space and beds as patients sleep on the floor whilst men, women and children share the same detention ward. It's about 10:30 a.m. when we arrived here. Several women were spotted queuing to be attended to. Whilst the fortunate ones sat on the few benches available, scores of others were seen lying on the floor. The facility is faced with several challenges. Physician assistant Mr. Alasan Eric has been at post for 7 years now. Mr. Eric lists a number of challenges hindering health delivery in the area.
The major challenge is staff strengthening. We have lack of staff, and then our staff accommodation. I'm the only person staying by the clinic, the health center. The rest are staying in town. And if anybody comes as a stranger, he's sick, he comes to the health center in the night, he doesn't know where to locate the nurses. Because not all the time that happens. Sometimes you can go for workshop, you can go for meeting, and then when they come like that, it becomes a problem. Sometimes too, we have challenge of drugs. Because we are here, only one health center. Sometimes when we are lack of drugs, people come disturb. You refer them, and then they don't want to go. And you too, if you don't have the necessary drugs to handle the client or to treat them, they have to, by force, they have to go. The other challenges is accommodation, where we normally detain clients, tuberculosis patients. We have only single room that we detain both sex. Male, female, children, they all mix up because of the lack of a place for us to detain, to separate them.
During our visit, we met quite a number of women preparing to be attended to. Achia Gladys is one of them. She tells me there's only one midwife at the facility, and in her absence, there is no one to take care of them. The problem we are facing is that we have one midwife and one doctor. So when any of them is not around, we are going to suffer. So we beg on government to assist us with more staff. Osman Latifa is the only midwife at the Amoma Health Center. Latifa also explained how the lack of supporting staff is affecting health delivery in the area.
I work alone as a midwife, and as you can see behind the facility, we have a number of them attending ANC today, and I'm the only one who will see them. Sometimes I get home 11 p.m., 10 p.m., which is not helping, because if we were many, at least 2 midwives would have been better.
She's also worried with the increase in teenage pregnancies in the community.
You find teenagers of 14 years being pregnant, and they are coming, and it's my duty to take it on. Because as we are talking about these teenagers, they are supposed to be in school by now. 14 years. If you are pregnant 14 years, you should be in school.
The terrible nature of the road linking the community to its district capital is also affecting healthcare delivery. Latifa explained that some clients refuse to go to higher facilities when referred.
One, even the road is bad. If she wants to even embark the journey to any of the facility, she will have to pass through this horrible road. And because of the nature of the roads, sometimes when we even sense danger and you want to refer a client, sometimes I won't let you get into labor, then I'll refer you. But then I will let you because of ABC. The moment you talk about referral, That will be the end. She won't tell you anything. When she goes, she will not come back again.
Aside these challenges, the labor ward leaks whenever it rains, and intruders and cattle disturb staff and patients during the day due to the absence of a fence wall. Reporting for JoyNews, Anas Sabit.